From GC 90.7's Studio A on the campus of Gulf Coast State College, RAPLINE with Emily Balazs.
Well, close to half of American households have at least one family pet. That's according to statistics from the Humane Society of the United States. And of course, pets are a member of our family, and we want to keep them healthy and happy. And today on RAPLINE, we'll answer some of your pet questions sent in to RAPLINE. And our guest today is veterinarian Dr. Rick Bartels of Bayview Veterinary Hospital here in Panama City. Also with us is head technician Tiffany McAdams. RAPLINE, of course, a service of Gulf Coast State College and GC 90.7. Well, thanks both for coming on and talking pets with us again.
Sure, we enjoy it.
All right, so Dr. Bartels, first off, tell me a little bit about what you do at your practice and then about something new, the AAHA certification that you just received.
Well, first of all, our clinic does a lot of advanced procedures, first of all. Some of those would be laser, some of those would be laparoscopy, so we actually do surgery with a scope. But anyway, we do some advanced things. But recently we became accredited with the AAHA, which is for the American Animal Hospital Association. So there's the American Veterinary Medical Association, and then there's the American Animal Hospital Association. So there's two different groups. But anyway, the American Animal Hospital Association can accredit certain clinics. They come in, they give certain guidelines. They come in and check and make sure you're doing the right procedures, the right cleanliness, a lot of different areas. And Tiffany can go into that a little bit more. But we've recently become accredited, and I believe, and so when you go to a veterinary clinic, sometimes it's hard to know exactly, what you're getting. I mean, you know that the veterinarian's been through school and he's been certified, but as the clinic itself, you sometimes you don't know exactly what you're getting, and this is a way of accrediting different clinics, and we went through that and passed, and we're real proud of it. Tiffany, do you have some ideas on that?
It's just a higher standard of care that you can expect. And if there's questions or if you wanted to know more in-depth detail, you can just go to their website, AAHA.com, and it just tells you what they expect out of the hospital, what you have to have to pass. And it's just a better care.
So when you boil all that down in kind of layman's terms, what does that mean for the pet owner?
Well, the pet owner knows that clinic has been certified and knows that it's accredited, and it's just a level of care.
And so you said that you do a lot of advanced things and surgeries, but now can we bring our pet to you for just like general maintenance and shots and things like that?
Yeah, we do it all. We do it all really, from boarding and grooming to vaccinations and general spays, general surgeries, general exams. We do a lot of it. We do a little more advanced orthopedics than the average clinic. We do a lot of orthopedics and other types of surgeries.
And what would you say are some of the maybe top 3 or top 5 list of, complaints or issues that the pets are coming in with that you see?
Well, skin is a big one. Itchy dogs. And we have a question in here, and we're going to get into that a little bit. Itchy dogs would be a good one. Lamenesses. As we've made purebred dogs, we've come up with more and more genetic lamenesses, which is kind of strange. In the old days, you had mutts, and they might be hit by a car, but, when we got these certain purebreds, like, for instance, German Shepherds, 40% of them have hip dysplasia, which is a genetic abnormality of the hip joint that causes arthritis. But a lot of the joint problems we see or even bone problems are genetic in nature. So lamenesses, skin, And along with skin would be ears, and we're going to talk about allergies in a minute, but a lot of ear problems are actually allergies, which is kind of strange. And that can also, by the way, be seen in humans. Some of the ear problems in humans are caused by allergies.
Now, when you're talking about like some of this genetic lameness or like the hip dysplasia, are there interventions that can help, or if the animal has this, they have it, and there's nothing that can be done?
Well, one area to look into is before you get a pet, look into the background. First of all, talk to a veterinarian about different breeds, because each breed has different predilections to abnormalities. And then also to see if there's any way to prevent it. There's a lot of eye problems and joint problems that the parents can be tested for, the parent dogs can be tested for, and then you should have less of a chance of having it in the puppy. And then lastly, before you purchase a pet, in fact, when my daughter got a poodle, she took Dad to the vet with her to get him examined. But the point is, get the puppy examined before you agree to it, because some of them will show up even at 6 and 8 weeks of age. So that's the third thing you can do to try and prevent it. But some of it, and then there are some surgeries that kind of can help correct some of it, before it gets too bad.
Wow, that would be such a great benefit to have your dad, the veterinarian, go with you to pick out that puppy.
Yeah, she thought that was pretty cool. And as it turned out, luckily that dog's been a great dog, because you can't always pick everything up at 6 and 8 weeks of age.
You definitely want to do your research. Don't just pick a breeder that you heard about. Do your research. Research the breed. Make sure that your environment is going to fit, that you'll be able to properly give it enough activity if it's a high active dog like Border Collies. And research your breeders. There are just so many out there that just breed to breed to sell. And then you have the good ones that will test the hips, have them x-rayed, make sure they're certified. I mean, like he was saying, you can get certain things certified on your breeders. So research is key.
Sometimes people look at buying a dog and they're like, well, I'm just making this up, but say I can get a German Shepherd for $300. Well, you get a dog for $300, you may either have a lot of heartbreak or spend a lot more than that with the problems. So sometimes doing the research and spending more money is the way to go, because you have fewer of these problems. An example is if they are testing the eyes, they're testing the elbows, they're testing the hips on the parents of a golden retriever, you have a much better chance of having a disease-free life.
Now, when you say do your research on the breeders, are there specific resources that a person can go to check out breeders? Are there websites or anything like that?
You can start, I'll start with that and then you can finish. You can start with talking to the breeder and finding some references. You can go to the dog club, the Greater Panama City Dog Fanciers, and see, and then you can also talk with some veterinarians and see what kind of and then you can what kind of experience they've had with that breeder, and then you can also just ask the breeder, do you test, once you've talked to the vet, you've figured out what that breed is predisposed to, you can say, do you test the eyes, do you test the hips? And if they do, you should get documentation of it. I mean, I one time I love golden retrievers, and I went about getting a golden retriever and was told these dogs had been tested, and it turns out the male wasn't even 2 years old, which you can't certify a dog that's not 2 years old. So even the vet got tricked. So, but if you have something written, they'll have written results. That should help.
That was what I was going to say is the resources available would be going to that breeder's veterinarian and seeing the documentation, and anybody could type anything up, but their vet is going to be the key part in that.
And now, as we're talking about the documentation and research, on the flip side, are there any red flags that we should run away from this particular breeder something that should kind of raise our hairs a little bit?
Well, we have some local breeders that put out some dogs with deformities, that we can, almost count on. One is knee luxations, where the kneecap comes out of place. But some of these breeders, and the funny thing is you tell them about it and you'd think, well, we'll quit breeding that dog. And the other thing to think about is that, sometimes you get a dog and you don't do all this, but they will quote unquote guarantee the dog. But what the guarantee is, well, if it turns out bad, we'll give you a new dog. Well, when you've had the dog a year, especially if you have children, by the way, and you say, yeah, by the way, Rosie's not working out, we're going to get another one, that doesn't fly. And so, that kind of guarantee doesn't mean anything. The guarantee you might want is if they have hip dysplasia, if they have knee problems, we'll pay to have the surgery done. But I don't think there's many breeders that do that.
And you are listening and watching RAPLINE here on GC 90.7 and GC TV. Our guest today is veterinarian Dr. Rick Bartels of Bayview Veterinary Hospital in Panama City. Also, technician Tiffany McAdams. And we talked a little bit about getting your dog through a breeder. What about if you choose to adopt that pet from a shelter or some other source? Are there things we can do to try to make sure we get a healthy dog?
There are, and you can even research where you're getting them from. You may think, well, we're in Bay County, how many possibilities are there? But without naming names, there are several. So, that's one, and Tiffany will have some ideas on this as well. But also figure out, do your research, just like you were when you're buying a purebred, do some research. And even if they're mixed, that still will give you an idea. If it's half German Shepherd, that may tell you something. And then find out, ask them if they've had any problems recently, because there are certain diseases that kind of go through kennels. And when you put, 30 or 40 or 50 dogs together, there's a chance they'll have upper respiratory. There's upper respiratory is really a problem in kittens. Or, some of the parvovirus. So you may want to ask them, have you had a problem recently? And a lot of times they'll have notices up. They'll have notices up that we recently had a problem. So that's a couple of ideas.
And a few things you can look out for, you were saying red flags, would be gait. Watch the parents. If you're getting from a breeder, watch the parents walk around. Demand to see the parents first of all, because if you're going to buy a puppy, then you want to see the parents. Look at their skin. Do they have skin issues? Because if they do, they're most likely passing that gene down. If their gait looks funny, and have them put them through their paces just like you would a horse, and walk, trot, run. And if that gait looks funny, then you most likely getting a genetic issue. Check their ears. If their ears are really filthy, that can be a key to ear issues. So, and with shelter pets, I would agree with Doc on that. You just kind of have to research the breed that you think it is. And it's a mutt. I have 2 mutts, and they've been the best dogs.
Some of these genetic problems, by the way, are diluted out by crossbreeding. But not all of them. So a lot of times a mutt is a better dog.
Is a healthier dog sometimes.
Purebred. And the other thing is make sure you actually see the facility, and make sure you see the facility. But also, if you have children involved, you may want to see the facility beforehand. Because, if you show up with your kids and you've said, we're getting a dog, but then the place is dirty and not well taken care of, it's kind of hard to say, yeah, kids, we're going home. But, and if the person wants to say, well, I'll just meet you so-and-so, no, you want to actually be at their facility, because they and get the dog, give them a deposit or something, but get the dog into a vet and let them check them out. Because there's a lot of things, the lay person can't figure out in a dog, whereas a veterinarian can.
And with that, let's go to some of our questions that we had emailed in. The first one is titled "Lonely Dog?" Millie, an 8-year-old Cavachon, says used to constant human companionship, is now alone during the day after the death of our mother-in-law. Question is, do dogs have a concept of time? Does Millie understand that we're gone for 8 hours during the day, and is she likely mourning the death of our mother-in-law, who was her constant companion?
Well, I think they do have a sense of timing. You know, they do understand the difference, and they have routines. You know, I mean, we know that. I mean, if you feed your dog every day at 5 o'clock, they don't need a clock to figure that out. They're coming up to you. So they know mom was there or grandma was there all the time, and now they're not, and that is a difference for them. But as far as the mourning, yes, they will mourn, you know, the loss of a human or the loss of another pet. If there's several pets and then one passes away, they'll mourn. Usually, you know, they'll get through it, obviously. And it's usually, I just say a ballpark, about 3 weeks, they usually get through it. But if it's severe, we do use some Xanax on them to kind of relieve some of the anxiety.
And now, does leaving the TV on during the daytime, does that make them feel like they have company, kind of help ease that?
Well, and I think it's more the noise, because in my experience, they don't watch TV a whole lot. There are a few, you know, I've seen them watch ping pong, you know, and they'll go back and forth. But the noise is important. So maybe not, you know, the TV's fine, or even a radio. But yeah, some kind of, you know, background noise.
And if they do have radio, make sure it's tuned to 90.7 FM.
Yes,
Did I fail to say
You
that?
failed that. All right, now let's talk this question about anxiety and fleas. Actually, anxiety, we'll take that, and you kind of touched on that. Question is, how should you leave a pet to prevent separation anxiety?
Well, first of all, separation anxiety can be a real problem. I mean, it might sound kind of cutesy, but it can be a real problem. We've had dogs that ate through door frames to get out, to try and get back to their owner. So it can be a real problem. Training them out of it, I think, can be very difficult. The technique would include tranquilizers, but it would also include a technique where, let's say you go to work at 8 and you come home at 5. Well, before you go to work, you know, you grab your keys, you do whatever. Well, you would do that, and you would go ahead and leave, and then you would come right back, okay? And then you would do it again and stay out of, you know, 2 minutes longer, and then a little bit longer, and a little bit, and each time you would praise them and give them some treats, and you would expand that eventually to the 8-hour period. Now that takes a lot of patience, but it does tend to work, but probably tranquilizers would be a big part of it. But some of the time that can be a real problem. I mean, a big problem.
Wow. Okay, and as the second part to this question regarding fleas, I'm concerned about the harsh chemicals and flea treatments. Are there, quote, natural or non-toxic flea remedies?
Well, you know, as a disclaimer right up front, I have to say that I'm not that big into natural and no chemicals, so, you know, you're getting kind of a biased opinion. But I don't think there's a lot of natural products that work. We have people that try it. You know, it used to be brewer's yeast and different things, and most of those don't work. What I would say is that this chemical idea, I think, was pertinent, you know, 20 years ago when we were using some pretty, you know, harsh organophosphates on them. But I think a lot of the products we use now, you know, are very benign. Now, they are chemicals, and if the people are just totally against chemicals, you know, that's one thing. But the other part of that equation is let's say we're not going to use chemicals, okay? Then we get fleas, the dog scratches himself up, or the cat does, and then we're at the vet's getting cortisone, which we're going to talk about in a minute. You know, I'd much rather see the dog get a low dose of a safe chemical rather than having to be treated. And that's not even looking at the, you know, the pain and suffering, if you will, of a dog that's sitting there, or the owner that can't sleep because the dog's sitting there.
Yeah.
I worked with an Eastern medicine vet, and I've seen a lot of that type of stuff work for different things, but in my personal experience, even working with him, I've never seen the flea Eastern medicine work. We even have a couple of clients that have tried it in our clinic, and they came back with fleas. So in my personal experience, I have not seen the herbals work for flea.
You know, one answer that does work is Dawn dishwashing soap, but, you know, that doesn't have any residual. So, yeah, you know, you bathe them, it kills them all, great. But, you know, if they're on the dog, they're in the environment and they're right back on. And nowadays, there are a lot of flea products that work for a month at a time, and that's really what you're looking at. And if the dog's allergic to fleas, you know, you've got to do something.
You got stuff that once you got fleas in the house or in the yard, it is quite a pain to get rid of them. It can be a months-long process to get rid of them, because they can live along baseboard. They can live on tile for up to 4 to 5 years. It's and going into a new house, and you have a pet, and then they're flea-free, they can activate those eggs that have been laying there dormant, and now you have a flea infestation. So I agree with Doc on that too. The little bit of harsh of the chemicals in the flea medication far outweighs the getting fleas and the itchiness, and it's a pain once you have an infestation.
So eggs can lay dormant for years?
Eggs and larvae. What a lot of people don't understand is there's an egg, an egg, a pupa, a larva, and an adult. And the pupa is encased, just like butterflies that come out of their cocoons. And those things are impervious to everything. The only thing you can do is burn them. So let's say you have a flea. Let's say you move into a new house and the old owners had fleas, and you go to the exterminator and you say, I don't care what it costs, I want the fleas out of here. Literally, he or she can't do that, because the pupa, there's nothing to do with that. So the only way he or she could do that is to do it and then do it again in a week and another week and another week, because those pupa are immune to all of it.
Wow, I didn't know that. So
so that's one reason why it's important to prevent these fleas rather than, you know, treat them.
Wow, interesting. Okay, and kind of following on that same line there, itchy cat, this question coming in from Elizabeth. She says, my cat constantly scratches itself. We take it to the vet every couple of months or so for steroid shots to counteract the scratching. However, this hasn't solved the problem. She's already on Comfortus, and no fleas have been found. Nothing we do seems to help, and it's getting quite expensive. Any advice?
You want to start on that one?
Oh yeah, this is when you going in and you're getting steroid shots, you're risking liver issues for long-term treatment of itchy skin. My personal view on treating any symptoms is if you can't diagnose it. But that is quite diagnosable. There is allergy testing you can try. There is skin scraping you could try if he's might have a parasite that's aggravating him. But in that case, I mean, cases like that, you're risking long-term issues with the steroid injections. And whereas you could probably, with allergy testing, you have the HESCA, that's what we use. You could potentially, it might be a house plant that's causing it that you could take out, and then you're not spending that money every month. Or it could be to the point where you have to do injections to help them. But sometimes it's as simple as removing a plant that's causing the allergy.
So now, is this common? I mean, is that commonplace to offer allergy testing at most veterinarians, or?
It's available at probably most, yeah.
Okay.
Yeah.
So
and what she was getting to with the injections was not cortisone injections, but injections to desensitize the pet. So figure out what it's allergic to, and if you can, remove that from the environment. But if not, then desensitize the animal by giving injections on a certain, you know, and it's all regimented. You know, we show you how to do it and the time intervals and whatever, but that's what she meant by the injection.
Yeah.
And the other part of that question is there something other than injections? Mm-hmm. And first of all, cortisone injections, a lot of them are bad. In Florida, a lot of dogs are going to get 1 or 2 a year, and that's not that bad. But there is pill form of cortisone that could be used, and it can often be used, and you can taper the dose down to whatever dose they need. So the cortisone that's given with the needle can be given with pills. But if we're talking about a cat, and I think we were.
Yeah, cat.
Pilling a cat on a long-term basis may not be a lot of fun.
And sometimes it's food related too. And it's as simple as changing to a, like Heels has ZD, and you just put them on an 8-week trial of it, and during that, or longer sometimes, right? Mm-hmm. And if they get better, then it's food related. Mm-hmm. And now it's just a simple change of diet.
So that would be a hypoallergenic food, mm-hmm. or what they call a novel protein. And what that means is a protein that the cat or dog's never had before.
Oh, okay. All right. This is another cat question from Melissa. She says, I'm concerned about my 1-year-old cat's breathing and nose. She's a rescue, so I'm not sure about her history. She's small, spayed, again, a cat with a small face and nose. When she breathes, it sounds loud, but she's not in distress. Question, can cats have a deviated septum? Should I be concerned about this? Is there something that could cause problems later on?
Well, there's a lot of variables there. I don't believe many animals have deviated septums. I don't really know why. But kittens can have upper respiratory infection, and occasionally they have long-term problems from it. It causes a sinusitis that's kind of a chronic problem, and so that could be part of the equation. And lastly, some of these short-nosed cats, like Persians and Himalayans, they do have some respiratory problems, and what's normal and what's not normal for them, it may take a veterinarian to figure that out. Now at our clinic we do scope, we do scopings, and that may be necessary to see what's going on. Is there something in the back of the throat that's causing a problem? But it may be that this kitten had some problems as a youngster, and it's more of a chronic problem.
And now when you say scoping, is that like down a tube camera down the nose, throat?
Mm-hmm.
Yeah, we do both. And then if she has outdoor exposure, and this is a recent ongoing issue, cats can get blades of grass up their nose, and it can cause irritation. So, you would definitely want to just go to your vet and have the cat examined and all factors considered.
And by the way, we were talking before the show, and we were saying, a lot of these, the end answer is see your vet. Mm-hmm. And that's, that has to be put in there, that, we're trying to do the best we can. But, she's asking what's normal for that kitten. Mm-hmm. Well, a veterinarian is a good way to go. And also some of these questions about cortisone injections, these are things where you just need to ask the vet, about it.
Okay, have a personal consultation and see your vet about that. You are listening and watching RAPLINE here on GC 90.7 and GC TV. My guest is veterinarian Dr. Rick Bartels, and we're answering some of your pet questions emailed to us. A couple more questions here. Over-the-counter treatments. Is it okay to give my dog Pepto-Bismol for an upset stomach or aspirin for pain? Could they be harmful?
Yes.
Yes, you can give it to them.
That's the short answer.
And yes,
no.
They could be harmful.
Yeah, the Pepto-Bismol sounds pretty benign,
Mm-hmm.
and actually kaopectate is pretty benign. Pepto-Bismol is not quite so benign, but it can be given, but it's, a matter of amounts. Aspirin can be given. There are a lot better pain relievers now, a lot safer ones. Aspirin can be used now. Let's clarify, cats do not get aspirin, okay? Dogs can get aspirin, cats cannot get aspirin. But there are a lot better methods of pain relief than aspirin. But on a short-term basis, a veterinarian will often, use aspirin at home.
Okay, and anything you wanted to add to that?
Yeah, I was just going to say, for an upset stomach, one of the best things you could do is to remove food and water, or just very small amounts of water, for 24 hours. That's the best thing, without giving medication, and just give their tummy a chance to rest, because it may be something really benign that maybe they got into picked up off the floor that isn't agreeing with them, and sometimes just removing food for 24 hours gives them a chance to settle, and then they can go back to their diet. And with the upset stomach too, if you know they're chewers, if you know your dog will chew on stuff, look around your house. If you notice anything chewed or it's missing or you can't find it, one of the best things is just go straight to your vet, because he might be blocked.
That's a good point.
And another good point on that is we have some dogs that come in and they've eaten something and it's lodged in them. And, the dog has been doing this for a long time, but he passes it. And they don't think a big deal of it. They may pass carpet threads, and they think it's kind of cute and whatever. But, if your dog is a chewer like that, you really should baby-proof your house, just like you did when your kid was 2. You need to get all that stuff up and find toys that the dog can't chew up and swallow. And the same thing goes with cats. We occasionally take sewing thread out of cats, and some of them are just kind of inquisitive. But if you know your dog's a chewer, or if you see foreign bodies in the stool, yeah, you need to prevent that.
And the earlier you can get in, the less traumatic for the patient. So say if it was a chewer, we do endoscopes, and we can remove objects from the stomach before it can get into the bowels and lodge there, because then that is having to cut open the stomach and go internally. But the scoping would, if you catch it early enough, you can normally go in there with an endoscope and remove it. And it's a lot less traumatic. There's no cutting, a little bit cheaper than going in abdominally.
I was looking on your Facebook page and saw like a Ziploc bag full of candy wrappers that you pulled out of somebody, and some looked like black rubber ball or something.
And we did that with the endoscope, actually. Yeah. It was a long process. There was quite a few candy wrappers.
Yeah, he actually got bound up on candy wrappers.
Wow.
We had another dog, which was, was not very important, but he was bound up with sand. Horses sometimes will get sand, what they call sand colic, where they've just eaten so much sand, but in the years I've practiced, I've never seen a dog that was bound up by sand, but this one was. And that's pretty hard to prevent. I mean, if you got a sandy yard, you're kind of out of luck.
Wow, that's interesting. Last question from email, this one regarding a dog in a limp. From time to time, my dog will yelp and hold her paw up when she jumps off the couch or bed. Now, she generally stops limping within a minute or so. This happened a couple of times in the past month. Should I be concerned?
Well, that one kind of goes back to what we said, see your vet, because, without, feeling it, and, it's pretty hard to diagnose. But briefly, if it's a front leg, it's kind of wide open. Could be a lot of things. And it would have to do with the age would be important, because dogs that are 8 months to a year can get some shoulder problems. But anyway, getting back to the back leg, that's where that patella luxation that we talked about, where the kneecap comes out of place, that's pretty typical. They bounce down, it hurts, and then it pops back into place, and then they feel okay. And that's one of those early intervention. If we can get to it early with surgery, by the way, the surgery can be a lot easier and a lot more effective. So if it's a back leg, it could be a patella problem. If it's a front leg, it could be a shoulder, or it could be a lot of things, but that pretty much takes a veterinarian to figure out.
With the knee, I was just going to add that the longer it's left out, you start messing with the bone can actually change. It deviates. Is that what I'm looking for? It can deviate, and then it's like permanently like that, and they look really bad when they're walking, and their legs will. It's really weird to watch a dog that has that long-term patella that's been left out, because it totally changes their conformation down there.
Yeah, it bows the leg, it bends the bone, but the last stage of it, the patella is actually locked outside of where it belongs. So if it belongs here, which on radio is not going to help much, But if it pops in and out, but if it's left out long enough, it'll get there where it cannot go back where it needs to go. And that makes the surgery a lot more difficult and really a lot more iffy as far as prognosis. So if you can get to those early, it's a lot better.
And before we wrap up, it is summertime, so I wanted to ask you about summertime toxins, any plants, things in the yard that we should be cautious about with our pets.
Well, it's so obvious that you don't even really want to mention it, but, water is the big deal, and I know you didn't specifically ask about that, but, we still see. Well, we saw, and I'm kind of getting out of, but we saw a dog at Walmart the other day that was locked in a car, and they had to call the police, and, it's like, really? I mean, are there people that, ignorant? But, water, even if they're in the backyard, they need water. And sometimes you can put water out there, but a puppy's going to knock it over, so you need water, and you need a water bowl you can't knock over. But there are some toxic plants, and there's so many you need to look them up. But poison ivy can be in yards. Poison ivy can be, we go for a hike with the dog in a new area. Poison ivy, poison oak can be out there, so that can be a problem for them.
What about?
I'm sorry. The ASPCA website, they list a lot of the plants, but specifically here in Florida, sago palms. If you have one in your yard, the leaves and the bulb. The bulb especially can be deadly, causes kidney damage, and I've seen a few die from it. So because it's not caught early enough, they didn't realize it was that. They brought them in, and then we're left like, what happened? But walking, if it's too hot for your feet, then it's too hot for their pads. Dogs come in with burnt pads, and it's so hot down here. So if you want to walk your dog outside, put your own foot on the pavement first, so you know whether or not they can tolerate that. They sell summer shoes that you can buy or purchase online. And the heat, just if it's 79 degrees outside, it's 100 and something in that car. And I think the ASPCA actually lists the temperature differences for heat outside versus what's inside the car. And I saw one the other day too in Winn-Dixie's parking lot, and the lady was actually coming out, so I didn't have to call the cops, but the dog was seriously panting. It was like 2:00 in the afternoon. They die from that a lot down here.
Well, and the other thing is sometimes people will crack the windows, and that's all well and good, or they'll put them in the shade. But, if the sun moves, the shade moves. And so that's something to think about. But even if you crack the windows, what you have to ask yourself is, would I want to sit in that car for an hour? It may or may not kill the dog, but is that really what you want for the dog?
So again, how about this? We're taking our pets with us, traveling around for vacation, for a road trip, and we have air conditioning. How often do we need to be offering them water, even in that condition, when they're inside the AC in the car?
Well, if they're in the AC, maybe every hour, every couple of hours. But if they're in the AC, that's a whole different ball game. And you can, of course, get tranquilizers or sedatives, which just makes that ride a lot easier for them. And you can also get antiemetics, which prevents them from vomiting. We get a lot of dogs that get car sick, but you can use antiemetics on them as well. But the sedatives are a big deal because they, a lot of dogs, the main time they get in the car is when they go to the vet. So they don't know that they're going to grandma's house. So it's a good idea to go ahead and give them a little tranquilizer. And, your vet has something that's real safe.
So we for those pets that, like one of my dogs only really gets in the car when she goes to the vet. So maybe I should be acing her before she goes to the vet if she has that already on hand.
Well, and the other thing is this is off the subject, but a lot of people will just bring their pets by and they go to the vet without having to, have vaccinations or get their temperature taken, and then they get a little less apprehensive about the whole deal.
We actually have a client that just did that with her big dog. He would always let out urine because he was so scared. So she just started actually just bringing him by occasionally, like once or twice a week, and only stay for a few minutes, but just walk in, walk out, basically. And he is to the point now where I was able to do radiographs on him the other day, take blood all by myself, and he not once let urine out and didn't act afraid of the situation at all. So he's absolutely great. And that goes back to that separation anxiety. That's that slow process. It takes time, but it's very effective if you can invest it.
Oh, that's a good idea. Just kind of drop by and visit your vet every now and then, say hi so they don't freak out as much.
And, you know, if you think about it from the pet's point of view, you know, every time he turns in there, you know, good things do not happen. So it's no wonder he's kind of puts his brakes on beforehand.
Right, that's a good point. As we wrap up this edition of RAPLINE, any final thoughts that you both want our viewers and listeners to go away with today?
Well, we talked about stool and we talked about vomiting, but I want to hit on urine real quick. If male cats can't urinate for a couple of days, a lot of times they'll get crystals and they'll get stones. But if they get what we call plugged up, a lot of times it'll back up into their kidneys and kill them. So a lot of people will leave their cats for a few days, you know, and just leave food out. And if it's a female, to be honest with you, that's not a problem. But a male cat, you need someone to check in and make sure he's urinating. And also on the dog side, male dogs actually have a bone in their penis, and so if they get stones, a lot of times a female dog can pass a stone, but the male, it gets stuck. And we have one over there now that it got stuck. So, you know, the idea there, now dogs can last a little bit longer without urinating, but still, it's a good idea when they go out and they lift their leg, make sure something's coming out. But if your cat is, now I'm kind of bouncing back too quick, but if your cat, you know, is squatting and not having any urine, that's an emergency. And if the dog, you know, if you're walking your dog, make sure something's coming out. And if he's continually trying to urinate, that's a problem.
Ah, okay. That's a vet emergency.
I would say for our clients at our hospital, we put out seasonal things, sheets that explain the seasonal hazards. Every season has a hazard. That dog that we removed off the candy wrappers, that was around Halloween. I would definitely advise anyone to do their research on seasonal hazards. And like I said, they can always stop by our clinic too and pick up a sheet and tour the clinic.
Okay, and anything else you want to add?
It's been great being here.
Okay, well, as always, your visit always prompts a lot of questions from our audience, so thanks for answering those questions, and we'll see you again shortly, I hope.
All right. Great.
All right, and thanks again to Dr. Rick Bartels of Bayview Veterinary Hospital, also Tiffany McAdams, head vet tech there, for joining us. RAPLINE, of course, a service of Gulf Coast State College and GC 90.7. And a reminder, if you're thinking of adding a pet to your family, consider the adoption option. You can check out our Pet of the Week on our Facebook page. I'm Emily Balazs. Thanks for listening and watching, and have a great day.